recruiting and staffing firm. We've been around since 1983, and we're founded and still headquartered in Hanover, Maryland. We've been in the Charlotte area for probably a little over 20 years. I myself, I'm coming up on 6 years with the company. I joined right after I graduated from the University of South Carolina down in Columbia, moved up here for the job, and originally started as a recruiter, as everyone in our company starts. I started out in our healthcare division, which is what I'm still in now. So we have in Charlotte, we've got 3 different offices, and we support about 10 different industries. So Annalise, Jackie, and myself, we sit in what we call our professional services division. So we work with corporate locations, shared service centers, and call centers across a wide range of industries, and support a number of different skill sets. Anything that's in an office, whether it's administrative and clerical types of roles, customer service and sales support types of roles, and then any front or back office types of positions as well. And as I mentioned, we're tied to our healthcare division. So we'll a lot of times say administrative health because we don't do anything on the clinical side. So we don't hire for nurses or doctors or anything like that. A primary focus for us, if I had to break it down into 3 tiers, in Charlotte, we do a lot within revenue cycle management. So your accounts receivables, your insurance follow-up, reimbursements, another word that you might hear. So we work with a lot of provider offices and in their business offices. And we also work with revenue cycle management consulting firms who are kind of similar to Aerotek. You know, we work with other companies to help manage their hiring. Revenue cycle consulting firms will work with hospitals throughout the country and manage their business office and their revenue cycle. After that, we do a lot with insurance carriers and payers, and those are more like claims processing, data entry, and customer service types of roles. And then our 3rd tier, it's not as big as the other buckets that we service, but it's centered around medical device and healthcare technology. So maybe there's like a company that supports billing software or a computer program for medical records and health records, or any of the med device companies that are here in Charlotte. Maybe they're providing chairs and beds for seniors at home, and stuff like that. So we're excited to share a little bit about, our experience and what we're seeing right now. Obviously, it's a different type of job market than what you were probably expecting as you were entering in your final semester. Over the last really year and a half, we've started working with several graduates from the Health Systems Management program, and we love the program. I can't tell you how excited we are to get to spend a few minutes with you this afternoon. We've had a lot of success placing folks from this program in different roles with our clients here in Charlotte. A lot of what we do is what we call contract to hire recruiting. So really what we'll do is we'll work with a company, we'll get an idea of what they need to see in an applicant. We'll source and screen the candidates and then set them up to interview with our clients. And then if they get the job, they'll stay on as an Aerotek contractor where they're still working on job sites with our clients, and really treated as a full-time employee. They're just getting paid by Aerotek. And then after a certain probationary period, sometimes it's 3 months, sometimes it's 4, sometimes it's longer, employees will be eligible to convert to become a full-time employee with some of our clients. So I'm excited to answer any questions that you all have. Again, I know that this is a very interesting time for a lot of us. I can't imagine going through my senior year having to leave campus and just finish out my coursework remotely. So I give you all a ton of credit because that's adversity that I didn't have to go through when I was graduating. So we're excited to talk to you, answer any of your questions to the best of our ability, and give you an idea of what we're seeing. I mentioned that I've been with Aerotek for almost 6 years. Annalise and Jackie, they both started on the same day last year, so they've been with us for a little over a year. My role, I focus primarily on business development and recruiter development. So my goal is to work with as many organizations in Charlotte, act as an extension of their hiring team. And then Annalise and Jackie, they work very closely with candidates in the market, and help fill the open positions that we have. So Jesse, I don't know if there's anything you want me to mention before we get started, but that is a long-winded intro into our team at Aerotek.
Nope, that sounds great. Thank you so much for that intro.
Very good. Very good. So I'm going to pull up, Jesse, your email that went over some of the different topics, unless there's a particular place you want me to start. Any preference?
Totally up to you.
Okay. Cool. Cool. And I know that Jesse has the chat function open. So if you guys want to chat out your questions, I'll try to answer them in real time. And I know that we'll also reserve a time towards the end, excuse me, to answer any other questions that you might have. Annalise and Jackie, you know that once I get going, I can talk forever. So feel free to jump in whenever you feel like it. So right now is a very interesting time when we're talking about searching for jobs, because you know, one of the difficulties in our world right now is figuring out who's even hiring right now. And it's kind of like a guessing game. And one thing that everybody can agree is that the coronavirus has impacted all types of organizations, pretty much every organization in some form or fashion. What I've been sensing and what I've been feeling, you know, for the first, I guess really the last 2 or 3 weeks in March, all companies were scrambling, trying to determine who was essential in their workforce, who they needed to keep on board, how they were going to get everybody to work remotely. And it seemed like everyone was kind of in scramble mode. Now what we're starting to see the first couple weeks in April, and I'm expecting to see it continue to progress, is that companies are going to get a better idea of what they're able to do right now, and they're going to adapt to the current climate. So it's been rather encouraging to see that certain folks are thinking that maybe we'll return back to the office in May in some staggered type of model, right? We might not have our entire workforce back in the office, but maybe we'll have a portion of them. I think it's still going to be quite a while until we get back to the way things were prior to the outbreak of the coronavirus. And one thing that is, I don't know if interesting is the right word, I feel like healthcare is an industry that is forever going to be impacted. We're reading a lot of news articles right now that are tied to just the cost for hospitals right now. As you know, a lot of health systems have surrendered, at least temporarily, the use of elective services. So a lot of appointments that you might want to schedule that are maybe like routine checkups, or maybe if you feel like you got something nagging in your throat or whatever the case is, a lot of those elective services, they're put on hold right now. So as a result, a lot of the business offices that we work with, they've had to move around their staff because they essentially don't have the same workload right now. Now, at the same time, a lot of the billing offices and billing teams that we work with, they're reaching out to insurance companies to follow up on claims that might have been denied, because there have been a lot of patients, as you know, admitted to the hospitals, and hospital stays are very, very expensive charges. And health systems don't want to provide services for free. You know, they want to make sure that they're attending to all of the patients that need care, but it is important that they get money back, obviously. And so they're experiencing very significant hold times when they're reaching out to insurance offices trying to get an update on claim statuses and getting money from those insurance carriers. So all that's happening right now, and then at some point later this year, the return of elective services is going to come. So we're working with a lot of business offices right now to figure out what their plan is for when hiring picks back up and when their workload is going to increase even more than what it was, you know, a couple months ago. So when we think about tips for a healthcare administration virtual job search, I always tell people to stick to like what you want to do. And I know that can be kind of a tough question. I know that I didn't really know what I wanted to do when I was coming up on graduation. I was lucky enough to have Aerotek really find me versus me finding them. But you all, again, as I've mentioned, have taken part and now are going to be graduating from a very, very phenomenal undergraduate degree program. And I'm sure that you've learned a lot of different things in healthcare, or about the healthcare in general. So I would just really encourage you, as you're reflecting back on your time, to think about the most interesting courses that you took, or the most interesting topics that were discussed. We're seeing a lot of a lot of roles, not necessarily eliminated, but they're evolving as automation is becoming a very, very big factor in healthcare. Billing software and billing programs are continuing to evolve to become more of like a one-stop shop where you can hold on to a patient's medical records and their entire medical history. You can register them for appointments, and then you can also manage their accounts and their bill balances and all that type of stuff. If I were to say what I think is going to be the biggest area for hiring over the next 6 to 12 months, I think it's going to be on the financial side of healthcare. So working with a Novant or an Atrium or some of the other independent hospitals that we have in Charlotte, I would encourage you to become very familiar with their websites. Start looking at what they have posted on their career pages, because there's going to be a big opportunity when you look at accounts receivable in a health system to find a job there. The impact of, and I don't mean to backtrack too much, but the impact of a health system eliminating some of their elective services translates to lost revenue, right? Excuse me. So, if I have a certain number of family medicine practices in my system, and I'm basically closing them all down for even 2 to 3 months, that's a lot of money that I'm not bringing into my hospital. So I look at paying my doctors, paying all of my clinical staff, all of my administrative staff. I'm losing a huge chunk of my revenue because elective services are going away right now. What that means is every dollar that a business office can collect from an insurance carrier is even more important now that they get it in a timely manner. I don't know what you all have studied when it comes to just the finance or the account receivable work in healthcare, but the longer a bill goes or a claim goes without being paid by the insurance carrier, the likelihood of receiving full reimbursement for that claim goes down tremendously. So typically when you're working in a business office in any accounts receivable role, you break things out by 30 days. A lot of hospitals try to have all of their bills paid within 30 days. The likelihood of that ever happening is very low. So they typically break their teams down into teams that handle claims within 30 days, and then teams that handle claims from 31 to 60 days, and then teams that handle anything past 90 days. So I think right now that's a big area of focus. So a lot of us should have LinkedIn's. If you don't have LinkedIn's, we can provide some more information on how to build an attractive LinkedIn profile and make yourself more marketable. I would encourage you to start connecting with as many people at Novant, Atrium, Caramont, Iredell Memorial up in Statesville. I would encourage you to connect with folks that have patient services in their title. Patient financial services is a good one. Revenue cycle is a good one. Business office is another good one. Anytime you see billing or even coding is really good as well. So Annalise, Jackie, you all have been connecting with some entry-level candidates here over the past couple weeks. Can you provide us an overview of the different types of conversations that you're having and maybe give us some perspective on the types of questions that you're getting from candidates that are looking for work right now, and then how you're answering those questions?
Yeah, so for the most part, anyone that I've been speaking to, specifically candidates who have health systems management degrees, or I should say that are coming up on completing their degree, are kind of left with a lot of confusion of like what avenues they really want to explore. So that's something that I definitely have been trying to, help as many candidates understand like what sort of things we see in the market and what we, are projecting to be, positions coming about soon. So really that's what I've been seeing more often than not, like not really knowing what they want to do. I actually spoke to a candidate this morning that is graduating from UNC Charlotte in May. And, he was the first person who was like, I know I want to go into an administrative position 100% within healthcare. So really, that was the only thing that I've seen from some candidates is just kind of not knowing what they want to do with their degree, but knowing they want to go into different avenues of healthcare. As David mentioned, we do have quite a few people that have graduated with the same degree that you all are pursuing, that have done really well for us in claim related positions. So that's something that, I've been trying to speak to a lot of candidates about that have been piquing interest, just because, I've seen success with candidates that I've placed in claim related positions.
Thank you. Jackie, what about you?
All right, can y'all hear me?
That's perfect.
Oh, okay. Hey, y'all. So I've talked with a lot of entry-level candidates lately, and you guys are just a breath of fresh air. We love hearing just how excited you guys are, in person over the phone right now. But I talked with a lot of people who have had internships within the healthcare field. Either they loved it or maybe they didn't love it. So I think when you're coming out of school, it's okay that you don't know what you want, but it's also okay to experience things and then well, I didn't like this about it, but I did like this about it. So I would just say get really curious whenever we're having conversations with people. Annalise and I kind of have a similar approach to things. Well, what did you like in this role? What was your favorite role? Is there anything that you liked in your internship that you want to avoid in your next role? Like, just get really curious. We get curious with you guys just so we can kind of narrow things down, because healthcare itself, obviously, is very broad. So just get curious. LinkedIn is really, really great. Annalise and I can definitely connect with you guys on LinkedIn, and we can have conversations after this, just kind of talking through what we're seeing on the market and things like that. But I would just say overall, just get curious and ask questions.
Thank you. That actually is a very good point that both of you kind of referenced. The likelihood of you finding like your dream job like right out of school, I'm not going to say that it's impossible, but there's a lot of different avenues that you can go with the different companies that are here in Charlotte, and with the degree that you all have, and you're going to be receiving in maybe a month or so. There's a lot of different directions that you can take that. So I echo what Annalise and Jackie said. I would encourage you to get really, really curious, because maybe you don't work with a health system. Maybe you go into consulting, or maybe because of everything that you've learned, you might find a really cool opportunity on the insurance side of things with a payer or a carrier. There's also a lot of different types of companies in Charlotte that aren't, they maybe work with a hospital. They might provide services to a hospital. So, for example, we work with a company in Huntersville called TriMedics, and what they do is they provide imaging equipment to hospitals. And a lot of what they do is related to like procurement and supply chain related work in healthcare. And that's a very interesting field, and there's a ton of career opportunities that are more closely aligned to supply chain related work than maybe some of the healthcare finance stuff that we've been talking about. So I definitely encourage you to get curious. Now's a really good time to learn and network. Just like you all, there are a lot of people working in home right now. So, I myself, as I'm more on the business development front, I'm finding it a little easier to get a hold of people on the phone and at least connect with them on LinkedIn and try to set up a time to just talk with them. So you've heard us mention LinkedIn a couple times. I don't want to limit it just to LinkedIn. I would also encourage you all to look at an organization called HFMA. So that's Healthcare Financial Management Association. Every state in the U.S. has a state chapter, and they even have local chapters. So they've got like a Charlotte chapter. I believe they've got a Raleigh chapter as well. But I would encourage you to look at HFMA and see what different membership opportunities there are. Typically, they will hold different chapter meetings and like volunteer events for you to participate in. And there are all different types of companies that go to these things. Hospitals, consulting firms, staffing companies like Aerotek, insurance companies, all different types of organizations. Now, obviously, I don't know when they're going to have a networking event, over the foreseeable future, just because everyone's, working under the stay-at-home order right now. But if nothing else, you might want to look at what a membership could do for you and who in Charlotte is a part of the HFMA. It'd be really good for you to connect with different people in any form of social media to see who's involved in HFMA. And then you can just get really curious around how you can get involved and what you want to do. And The biggest thing that I've really learned in my time here at Aerotek, obviously my job is to help other people find jobs. It's a really rewarding part of my job, but there's a saying, it's not what you know, it's who you know. You'd be surprised just where you can get in life and with your careers based on who you surround yourself with and who's in your professional network. So anything that you can do to have other people looking out for you is always a good thing. Now you have me, Annalise, and Jackie looking out for all of you on your job search. And if you're connecting with members of the HFMA or different hiring managers and leaders on LinkedIn, those are extra sets of eyes and ears for you looking out on your job search. So again, it's perfectly okay to not know exactly what you want to do, just because there's a lot of different routes that you can go. More on a one-on-one level, we can give you an idea of some of the roles that we typically hire for and the different types of companies that we work with. The cool thing is that Charlotte is such a growing city. There's a lot of different organizations, different types of organizations moving here every day. So I would just encourage you all to get really curious around the different types of companies that are out there. You don't have to limit it just to Novant or Atrium. I know that those are the bigger organizations that we're probably, probably more familiar with. But there are a lot of third-party organizations that are here in Charlotte that would be good for you all to know about. Do we have any questions so far? It's kind of weird because we're throwing a lot at you, and I don't want to overwhelm anybody with info.
Hey, David.
So I'll give a pause in case anyone has any questions right now. Yeah.
I'm going to jump in. You just mentioned, I think, and it's a great point, thinking about third-party employers who might work with some of those larger, well-known, name brands in the Charlotte area, Novant, Atrium. Can you give us some ideas or suggestions on how to find those sorts of companies who, again, might not be initially what you would think about when thinking about healthcare administration, but still works with or for those larger employers and within the industry?
For sure. HFMA is a really good resource. There are a lot of board members and committee members that work with different organizations. And if you go to that website that Jesse just sent out in the chat box, the nchfma.org, there's a page on their website that shows board of directors, and it also shows committee members. And so it gives their contact information, and it says where they're working. So that's a really good resource. I don't want to say you can Google different revenue cycle management consulting firms, but that's a good resource. It just wouldn't keep it specific to Charlotte. So you could look more on a national level, some of the different outsourced companies. I can tell you right now in Charlotte, we work with, I'll just rattle off a couple for you guys to research, but we work with Ensemble Health Partners. They're a fairly large one. They're in Huntersville. We also do a lot of work with a company called Change Healthcare. They're right there in the university area off of McCullough Drive, I think. We've done a lot of work with them over the years. Meduit, so Meduit is another company that we've worked with for close to 5 years now. And then there's a company down in South Charlotte, closer to the border of South Carolina, called Parallon, Parallon. So Ensemble, Meduit, Parallon, and Change Healthcare, they're all very, very reputable organizations. And what they do is they work with different hospital facilities throughout the U.S. And instead of saying, hey, we'll staff for you, they ask, we'll take on a certain number of your revenue cycle or your AR balance, and we'll work on collecting that money. So more of a consulting type of firm. They've got their own team of billers, and there's a lot of different paths that you can go down after getting your foot in the door with different roles that they have. So the types of positions that we typically fill are positions tied to insurance follow-up. So you're going to be working out of a queue, and you'll have a patient account that'll pull up, and it'll have a balance on it. And you'll have to research why the insurance company hasn't paid the claim, work with that insurance company to ultimately pay the claim, and then just kind of move on. So it might not sound, super glamorous, but it educates you a lot on just the financial world in healthcare and the importance of maintaining a clean AR. So those are some of the more reputable, I would say, third-party companies that are specifically tied to revenue cycle that look for candidates such as yourselves, and we've got working relationships with all of them as well. So I'm seeing a question come in here. Are there any rules of engagement that a student would need to know in working with your company? Would they be able to apply for jobs on their own or just through you? So no typical rules of engagement. I mean, I'm not in a position to ever prevent anybody from hiring. So yeah, I mean, if you want to look at their website, I always encourage people to look at their website and do what you have to do on your job search. It's going to be really interesting to see what happens over the next few months. It's been unfortunate, but there have been a lot of people in Charlotte who have been laid off or, furloughed even temporarily as a result of everything happening. So if I'm a company, I might have had to lay off part of my staff, and, I have every intent of bringing them back on in a couple months when I'm able to hire again, but they might not still be available. They might not still be around. What we have done and what is helpful in working with a company like Aerotek is we've got relationships with different employers in the area. And a lot of times, in a human resources office, they'll have a job that's posted online and they'll get so many applications. I mean, Annalise and Jackie, you guys can speak better to the amount of applicants that you get for your job postings. But if you have one job posting up, you might get 50 to 75 resumes within an hour for people applying to different jobs. And I would imagine once people start hiring again, that number is going to be even higher just because of the unemployment rate we have right now. So what we're able to do is we go directly to the hiring managers and let people know, hey, here's, so-and-so candidate, here's a brief overview of their background and experience, here's why we like them. And we're just able to cut through that red tape a little bit. And it's not a knock on any talent acquisition team or HR office. It's just very difficult to have the bandwidth to work through 50 to 75 resumes in a timely manner when you have a hiring manager asking you for interviews, and to fill a position rather quickly. And the ultimate fact is they might stop after looking at maybe the 25th or 26th resume, and you might be number 30. So they might not get to you before they decide to go with someone else. So that's what's been helpful in partnering with us. But again, there's nothing to stop you all from applying with companies. We want to help you out the best that we can. If we don't work with an organization, we're more than happy to reach out on your behalf. But we're always pretty transparent when we're talking to candidates. If they let us know that they're looking to work with a Novant, we let them know, hey, I don't know what you've been doing on your job search, but we work with Novant pretty heavily. In fact, we work with them exclusively in their business office in South Charlotte. So we're more than happy to make the connection for you. Jackie, Annalise, I don't know if you have anything that you want to add on there.
No, I think that you explained that pretty well. We, like David said, we go through so many resumes and whatnot, but we always make sure that, we're aligning with what you want the most, with what our client is looking for. We always like to make sure that we're, getting your goals, skills, and interests of like what you're looking to do and matching that up as best as possible. So that's, something that Aerotek takes a lot of pride in, making sure that we're putting you in the best position for you and for our clients. So, yeah.
Cool. So I see that Jesse has another question here. So any tips that we can share that will help students stand out as an applicant? Jackie, if we can still hear you, why don't you answer that? What tips do you have for the group that would help students stand out as an applicant?
I would say, obviously, make sure your resume, can you hear me? Cool.
Yeah,
I would
good.
say make sure that your resume looks nice and clean. I definitely prefer bulleted, like very detailed bullet points, like 4 to 5 really nice descriptions on what you've been doing. Definitely include the month and the year of every position. And then overall, just like bring the energy. right now whenever you're talking with people over the phone or video conferencing, whatever it may be. It can be a little bit different whenever you're, talking with someone face to face. So what always helps me, if it's going to be a phone interview or whatever it is to actually stand up and walk around. Sometimes just doing that kind of gets you moving a little bit and everything like that. So from an energy standpoint, you can definitely hear when someone's interested, when you're asking questions, things like that. And then on a resume, just making sure that everything looks nice and clean, everything's, all the font is together and things like that. That'll get you off to a good start.
Yeah, and what I would add on, thank you for giving those tips about like phone screens and virtual interviews right now, because that's obviously pretty big with everything that's going on. As it pertains to like resumes, I always encourage people to be as detailed as possible. So always listing out your courses and everything that you learned, or maybe some of the more favorite topics that you discussed as you were going through the program is always helpful. If anything, it shows that you have a particular interest in one area. So I like to see resumes that don't just have the degree, but it also talks about the different coursework that they completed. Any extracurricular activities or clubs or organizations that you've been a part of, whether it was a business fraternity or sorority or any other social types of groups, any volunteer activities that you completed while you were in school. Obviously, any work that you have, whether you feel like it's relevant to your job search or not, I love to see it. I love for people to have pride in what they've done, and especially if you've worked at any point while you've been in school. I know that that's not easy to do, so I always like to see that as well. And when you're listing out just what you've done, whether it was work experience, volunteer experience, or even anything in your coursework, I like for things to be concise and to be very clear, so I don't want you to feel like you have to ramble or you have to have something perfectly eloquent, if you will, as it's listed out, but just a brief overview on what you were mainly responsible for, for your different employment opportunities. If you had to list out the top 3 to 4 things that you were responsible for every day, that's what I like to see. And as it pertains to coursework, some of the main theories or topics that you discussed and what you learned is always helpful to know for me. I would encourage you to think about anything that is outside of school or work that you've done that is relevant to the type of work that you're looking for. So whether it's a volunteer activity or maybe you attended a webinar or some type of learning series that's relevant to what you're interested in is always helpful. And then this was an area that I was not very good at when I was on my job search as I was approaching graduation. I had one resume, and I sent that resume out to every employer that I applied for. And I was actually in an interview one time, and it was not for a marketing role. I had a marketing degree. And I had an objective on my resume to say, I want to obtain a marketing-related role. And what I was interviewing for was not marketing at all. And the first question that I was asked was why I said I was interested in a marketing role, but I applied for something that wasn't marketing related. And I was stumped. I didn't know how to answer it. So don't be afraid to have different versions of your resume. It's perfectly fine to tailor your resume based on the job that you're applying for. I don't know the level of work experience that everybody has. But even if it's the same job, but maybe you want to change up how you're explaining what you did to make it more relevant to the job you're applying for, I would encourage you to do that. So don't limit yourself just to having one version of your resume. It's good if you have a couple different ones. That way, for the different jobs that you're applying to, that'll help you stick out a little bit more. But that was a very good question. Annalise, anything that you want to add to that? What helps candidates stand out as an applicant?
Yeah, really to echo what Jackie was saying, bringing the energy really creates a difference. Part of what we do at Aerotek too is like we sell our candidates in. to hiring managers. So, when I have a candidate who's just super, super excited and shows me how, interested they are in the position and, just keeps that energy over the phone, it makes it so easy to speak to a manager about why they're the best entry level fit. Because especially now it's getting so competitive to, find a position as an entry level candidate without experience. So really making sure that you're highlighting yourself over the phone, you're really, expressing why you're the best fit and keeping your energy up really goes a long way. Even though it's something that might seem a little bit minuscule, but, that's what will set you apart from other candidates. So just kind of echoing what Jackie was saying.
Yeah, and one thing that just popped into my head too, stick up for yourself, I guess is what I would say. Like there are going to be a lot of times where you'll have someone talk to you about a job, and if for whatever reason it doesn't interest you, don't be afraid to say no. I know that for us, when we're working with applicants, it's almost better when a candidate says they're not interested in a job. That way we can just improve our job search for that particular candidate. We never want to be in a situation where we're putting someone in a job that they're not interested in. So if you're ever asked about a job opportunity or even a company that just doesn't check off every box for it, and you don't feel like you're going to be motivated to work there, just be transparent. We want you to get curious and learn and try different things. But if you feel like you're not going to be motivated working somewhere, when you're working with a recruiter, it's always helpful just to be honest and let that person know how you're feeling. Because at some point it'll catch up to you, and you just don't want to be in a position where you're not happy with what you're doing. So I know that's a little bit, it might go against what we've been talking about, but it's always important to let whoever you're working with know how you're really feeling about what's being presented to you. So I wanted to mention that too. So it looks like we've got a few more minutes. Any other questions?
David, I feel like it might be good to kind of touch on references really quick. I'm sure you guys, if you've, interviewed at all or, applied to any internship, it'll probably ask you for professional references. That's one thing that Annalise and I do reach out to when we're screening out candidates. So I would go ahead and start thinking of like 2 to 4 professional references. So when you are applying to jobs, you can go ahead and give them the heads up. Hey, I'm applying to jobs. You may be getting phone calls or emails. I can't tell you how many times I've called a reference and they're like, oh, I didn't know I was a reference. So always a good idea to give them a heads up and get their permission. With that being said, think of like people that either have been professors or your managers at an internship, any kind of supervisors, professional people who have worked with you that can speak on your behalf.
A very, very good point. Thank you, Jackie.
I have a question.
Any other questions? Oh, yep.
You can hear me. Okay, so thank you so much for everything you shared with us. In regards to, I just listed all the things you said were important things to include in our resume. I think my issue is, I feel like my resume doesn't, I'm sure many people struggle with this. First of all, everyone says the resume has to be at least 1 page, or at most 1 page actually, in order for it to be professional. But I feel like it doesn't, I'm not able to fully express who I am and everything that I have done in my life that relates to, let's say, the position that I'm looking for, or just to show my the variety of like areas I've gained experience through volunteer work, through whatever it may be. And so I don't know what's the best things to put out there. And I feel like 1 page really, it's just, I don't know how to explain this. It more so diminishes what I'm able to provide. I feel like it doesn't really fully show what I can provide. And then if that's the only thing that a recruiter is looking at before they ever call you, and then your resume isn't good enough to them, then they're never going to be able to actually speak to you. You're not going to get to that next step of actually speaking. I feel like speaking over the phone is where you can really present yourself and hold that conversation and express what it is like you're willing to provide and your interest in all of that. And I just feel like that's a challenge I'm facing right now, of just like not being able to get to that next step of like communicating further.
So that was a great point, and thank you for sharing. Yeah, a lot of people have different perspectives. For me, especially if you feel like you're you're not being best represented with your resume, I would definitely encourage you to put whatever's on there that's going to make you feel like you're better representing yourself. As far as the one-page thing, I mean, if it bleeds over to a second page, I'm not critical of that. I don't think anyone really is. I am a believer in like having something pass the eye test. So if you move on to the second page, my like unofficial rule of thumb is having at least 1/3 of the page filled. You just don't want a second page that only has 1 or 2 lines on it. But definitely, you know, feel free to put whatever's on there that's going to represent you in the best light. And, you know, you're right. That's the ultimate truth. A lot of times hiring managers are only going to look at company and job title that you had and how long you were working there. That's typically what they look at. And so that's another benefit when you're working with a company like Aerotek is a lot of times we don't even look at the resume. We dial the number, and then while we're talking with the candidate, we're looking over the resume and having them explain different parts of their experience, right? So I'd be more than happy to take a look at what you have, but I definitely don't want you to live and die by the one-page rule because I don't think that makes a ton of sense. It's tough to get everything out on one page, right, and to give you a true fair representation. So, yeah, feel free to have it move over to the second page, especially if you feel like there's information that is not being highlighted, you know, with your background, education, experience, all that stuff.
Thank you so much. I really appreciate that.
Yeah, no problem. Thanks for speaking up.
All right, everyone, I'm going to jump in here and just wrap things up. Thank you all so much for the conversation today, David, Annalise, and Jackie. This was fantastic information. And again, for those of you who are participating, we've recorded this. So I'll go ahead and get this posted to our YouTube channel, hopefully by later this week, and you all can access this. David, Annalise, Jackie, if folks have any questions, are they welcome to reach out to you via LinkedIn or anything along those lines?
For sure. I think you have all of our contact info too. If you want to disperse that however you want amongst the group, that's totally fine too. Email's good for us. So whatever's easier for you all.
All right, everyone, I'm going to go ahead and include my contact information in the chat box. So if you want to reach out to me and ask for contact information that way, I think that'll be easiest at this point. But again, thank you all so much for joining. Thanks for sharing your expertise.